appreciative of Casey and Voices for Georgia for putting on this particular event today. I've been asked that question about privatization over and over and over and over. And I will tell you this, that there's opportunity for privatization. Right now we have about 45% of our foster care system that is somewhat privatized. And so there's some opportunities. And I think Paige hit it right on the head. Where are we trying to go? And so I think that's the first thing we have to find out is where are we trying to go in Georgia? So regardless of, I'll say this, regardless of what happens with the legislation, my commitment to our state is that we will continue our partnership with all of the organizations and all the providers to do the very best for our children. And so we want to do what's best for our children. I think someone said, I think it was Don, that you said something that struck home. Georgia has to talk amongst Georgians about what's best for Georgia. And so once we do that, then we can figure out what's best for our state. Every state is unique. I can't go to Louisiana and try to tell Louisiana folks what to do. And certainly ain't going to try to go to Alabama and tell them what to do. No, I'm not going to Texas and Nebraska and Kansas tell them what to do. I think it's best that we sit down as a community of experts. You all are experts out there. We just need to come together and we need to bring in our judges. We need to bring in our legislators. We need to bring in all those stakeholders so we can have a conversation about where we want to go first, and then how we're going to get there. So I am very excited about this opportunity, and regardless of what happens, we are committed. I can tell you that right. We are committed to doing our very best to partner with folks in the community. One of the things I said when I first came on July 1st, and I sat down at the behind the desk, and I realized that, wow, this is a daunting task. There's no way in the world that I'll be able to control 8,000 people in our organization and the money that we have and all the resources to keep Georgia's children safe without partnerships. And so government cannot do it alone. I'm a big believer in that. Government cannot do it alone. Therefore, we have to have partnerships. So you have my commitment, regardless of what happens after the legislative session, that we will sit down and we will talk and we will bring in and we will brainstorm to find out where we're going. And then we're going to devise a path to get there, with everybody holding hands to get there. That's all I have to say.
Well, thank you to the Commissioner and the Director and the several people from the department that are here today. We do appreciate your partnership a lot. And so, I don't see a mass rush to the door, and I think I'm going to adjust the format a little and take questions from the audience. And if you want to direct it to somebody specifically, that's fine. If it's a general question, we'll see who's game to answer it. So, do I have a hand out there? I don't think it's one. Carly. Say who you are and who you are.
I'm Carl Lehman, and I'm with Child Code. I also serve on the Child Protective Services Advisory Committee. And the one thing that I hear from everybody is about where are we going? And I also hear about pulling all the stakeholders in. And how do we affect that here in Georgia? Because it seems the horse is already out of the barn. And I'm not sure how we can accomplish that at this point.
Anybody want to answer that? My only statement, I remember in our...
Let me reframe it a little bit for this, and I certainly want your answer, Paige. But for those of you who are already, who have been through this from the beginning, how would you advise advocates to address this particular issue of can we slow things down? Can we sponsor the conversation?
I'll pass this on down the line, but my first response was just what the commissioner is just committed to, having these community conversations, regional community conversations, to listen. I think under the governor's leadership, having that openness to listen to where do we want to go, and let's come to a consensus on that, and then talk about how might best it work, given Georgia's demographics and opportunities and challenges, and the outcome of the 4E waiver that might be submitted and approved. But I think that from that, just like in Tennessee when we had the conversation, there was not a fix-in on behalf of the State Employees Association nor the provider community. And both had agendas, and both wanted it to turn out a certain way. But I think it was just that open conversation, beginning at the Capitol and radiating out.
As I said, in Florida, although the process was intended to last several years, it lasted 8 or 9 years. And I think part of the reason for that was, first of all, the need for engaging in that conversation within communities, coming to the realization that, as I suspect is the case in Georgia, communities in Florida are very different one from another. In terms of their resource context, as well as interests and kind of who the players are, et cetera. And so the solutions needed to be crafted, and then there needed to be a very methodical readiness, preparation, and rollout, because you don't want to do this too quickly and not have stability in terms of the lives of the children and families that are involved. So I think building that community capacity and that capacity for conversation is an important part. I'll say quickly in terms of lessons learned, one of the things that was a part of that, because in Florida of the community-based care lead agencies, most of them, not all, but in fact one currently, although it's kind of phasing out, and historically there have been 2 relatively small counties where the county was the lead agency. But most of the lead agencies in Florida are private, not-for-profit organizations, and so they have boards of directors. So one of the early issues in Florida was what constraints or lack of constraints should there be around the boards, and for example, should providers be able to serve on the boards? And in some of the early community-based care examples in Florida had very much provider-dominated boards, and over time there evolved a decision that that was not appropriate and that boards could not have providers on it, number one. Number two, that the majority of the members of the board had to be Floridians, and of the Floridians, the majority of them had to live in the local community. And so there was a concerted effort to make sure the board of directors was community leaders and responsive to the community. And I think that was one of the important kind of lessons going forward, is the need to make sure that on an ongoing basis the governance of the local program, however it's constituted, involves strong input from community leaders.
I think if the horse is out of the barn, making sure that you have a crew around it that makes sure it doesn't get tired and has plenty of water and plenty of hay is a good idea. The more prescriptive that it is, in my opinion, the more challenging it's going to be. And so the more freedom that Georgians have to kind of look at their system and be able to make adjustments, because no matter what plan you put out right now, it's going to be different at some point.
And I'd like to say just one last thing about this ownership that Don mentioned. In the privatized system, he talked about the boards. In a state like Alabama, which is very similar to Louisiana, there is, state law requires there to be in each county and then statewide quality assurance committees made up of local citizens that are stakeholders in each county. And each one of those quality assurance committees is reviewing cases and system issues in those counties and providing that feedback and taking ownership so they can speak on behalf of the child welfare system when a child issue of maltreatment or fatality occurs. It's not just DFACS, it's our problem. We own this in our community. And that's something that was legislated to mandate this continuous quality improvement committees by county.
Other questions? Ron?
I just had a question on the whole idea of stereotyping.
You are.
Ron Strong with Together Georgia. I have worked in both the private and the public sector. And when I worked in the private sector, thought about all those lazy, no-good state workers. And when I worked in the public sector, I thought about all those money-grubbing private sector people. And what I find is, as you get into it, there's just 99% of people just fantastic, loyal, dedicated people. And the defect people we have in Georgia are just absolutely the best in the country. So I think, but the media and the public don't get into the roots like we do. There also is a side about stereotyping the people that receive our services or are part of our services. So how we get the children and the families involved, how we get the public and private. It's easy to say these things, but what we see happening in Georgia right now, moving down the road, is people have made decisions about what's best for our families and children, and they don't work with them. People have made decisions on what's best for DFACs, and they don't work there. People have made decisions about what's best for private sector. So any suggestion on how we get together in a more meaningful and quick way to make all these coming together happen? So that's what I would like to see.
A couple of things quickly about that, and first of all, I do agree very much with having families and youth involved. As a consultant, I'm very proud to work with an organization in Florida called Florida Youth Shine, which is the youth advisory group of foster care youth and alumni formed their own private, not-for-profit corporation, and they're a pro bono client, of course, but they, and I have a chance to do training with them every year on the legislative process, but they were very involved in the conversation in Florida, and particularly in the past 5 or 6 years, as that group has really gotten more involved, and there's just no substitute. And every time I meet with these young people, I'm just continually impressed with their insight and the wisdom and experience that they bring to the table. I think the other thing, though, and it's always a great opportunity for people to come together and hold hands and all, as long as you can keep your goals in a kind of a level that everybody can agree that it means whatever they think it means, and that as you go forward, there are some sticky wickets, and I'll say a couple of sticky wickets that people need to think through in advance. Is how you deal with liability. There's a big difference between being a child welfare provider and being a child welfare private agency that stands in place of the state in terms of potential liability. And in Florida, the legislature made a decision early on not to try to extend sovereign immunity, but to deal with liability through requiring coverage for liability insurance, and then in recent years has come back and provided some limited statutory immunity. But how you deal with liability issues, what's fair to young people if a child is harmed while in care, then do you want to shield the system from liability or not, because shouldn't that child be able to get relief, et cetera. So that's a big issue. The other issue is resource development and fundraising. In Florida, the first community-based care agency did a remarkable job in terms of resource development. The first foster home I ever visited that had transitioned from an agency home to under the private provider, the foster dad told me about the local company that had adopted the home and how they had provided a van so that he could take the kids to school and they wouldn't have to interrupt their education, and the playground equipment. And then the employees of that company were then mentors and helped the kids with their homework and were very involved in the life of the kids that were in that home. And a tremendous amount of resources that were far beyond anything that the state had been able to do. That's not been sustained most places in Florida. Part of the reason there was it was early disagreements between providers and the new lead agencies, with providers saying, we have our fundraising capability and we don't need a new fundraiser in this community. Thank you, please. And so working out those relationships of resource development and what led to the best result. Some of those kinds of liability, resource fundraising, those kinds of things are things that within that community conversation, people need to have a real honest chat about and see how those things can best work out for children and families.
And I'm going to follow that up a little bit because we do have some funders in the audience. And just generally, from your experience, has privatizing put more pressure on the philanthropic community? And can you be, and you are nonprofits, I understand that, but can you succeed without a significant increase in the philanthropic dollars on a continuous basis? Just as we've said, the public dollars need to be adequate. So any of you, or if there's a funder in the audience, I won't look at anybody in particular. There's a funder in the audience that wants to frame it differently, be my guest.
I can say very quickly, and I say this acknowledging my good friend and partner, Paige Wally, because when I was still with the state, now Lynn has worked with Florida also, and Paige has been a constant source of support, and Casey Family Programs has supported Florida's efforts. But as I said when I was in the public sector about Casey's efforts and some of our philanthropic partners, is that the technical assistance, advice, and counsel we got were probably more important than any money that we got. And I think that, at least my experience has been, and we have the Florida Philanthropic Network has been great partners and has done terrific work. But quite frankly, the philanthropic community in Florida cannot bring the sort of resources to the table that government can bring, both state and federal. But sometimes that money at the margin that comes through philanthropic efforts and other community efforts because of its flexibility can really have a multiplying effect. So I think money is important, but the involvement of leaders, and frequently the people who are involved in the philanthropic community are community leaders, and their leadership is, in my view, as important as the dollars.
I'll just say, I think that the work can be done without an enormous increase in donations or philanthropic partners. I think that in my experience, in my organization and similar organizations that I've worked with, what the funders have allowed us to do is go above and beyond. So we can meet the outcomes, we can get there, but just getting there isn't enough. We are on a constant drive toward improvement. If we have 99.89% safety, we still need to improve. So we use our philanthropic monies to do above and beyond. We bring in evidence-based therapies and training to our staff, even if it's not required, because we believe that there's a way in which we can improve services and get kids safer and get them to permanency more timely and improve well-being. So that is what we really find as the best resource for the funding that we get through donation.
Any other questions from the audience?
Let me just say that I know that Susie wanted to comment on that other question, but I will just mention this to Don about resources, and we talked about state resources, but in Florida, I just confirmed it with Don, these community-based care boards have taxing authority.
Let me modify that just quick. Local communities in Florida can choose through public election. Communities can choose at the ballot box to create special taxing districts. And those dollars created then go to child welfare. They are not the same organizations as the community-based care lead agencies. In some communities, they augment, and in some communities, they've said, we'll focus on prevention and primary prevention kinds of activities and things that supplement or are coordinated with. So there's a little bit different relationship from place to place, but that's only 5 or 6 places in Florida that have chosen to do that, and so one of the things you got to kind of work out is how do you equitably distribute other resources given that capacity in some places and the absence of that capacity, because the places that have that capacity want to enhance and not have their resources eroded because of what they've chosen to do. They want it to make better.
I just wanted to touch about the philanthropy aspect and also how it really alludes to supporting both your concern and your question as well. Whether there's a horse that's racing or whether we haven't had the chance to have those conversations, that is not something that government usually can fund very well. Having those conversations, making sure that there really are community forums that are going on where everybody is engaged and someone is keeping up with things that are shared through that and that goes forward, and having some leadership and champions to do that. And so that's certainly something that when we reformed juvenile justice in Louisiana a number of years ago, we were very dependent on philanthropic partners to come in and create those opportunities and avenues for some of those conversations. And I certainly recognize that might be something that you all need quickly because there is a horse race going on. And so having somebody to help bring folks to the table and those kind of partnerships can be a very important and powerful activity that philanthropic people can do for us. Because again, if I as a government person were to fund breakfast or luncheons or any of those things, people say, what is she spending her money on that for instead of the kid? And so it really does, but it's important. I've had people argue people should be able to come together without any resources, and I don't think that happens as well unless you have some really strong leadership. So I just wanted to comment that that's another opportunity that could help the other questions arise.
And thank you for that, because we have a great model in Georgia of our Just Georgia coalition that has done that around juvenile justice. Any other questions? Oh.
In discussing Florida, you talked about how the state applied for the 4E waiver and you were able to lock in the federal funding at a fairly high level, I believe. And I wondered what advice you would have for a state on the question of flexibility versus the amount of funding. If in getting a 4E waiver, the state would be locking in at a low level of funding because of small numbers of kids in foster care.
Yeah, the kind of high level, low level. The key thing there, and it's a longer conversation, but and a more complicated conversation. But essentially, the level of federal funding that is available to states using a 4E waiver is the answer to the question: in the absence of the waiver, what would the state have received in the next 5 or 6 years in federal funds? Then lock in that amount, and then receive that amount. And then if you're able to safely reduce the number of children in care, reduce the cost of care, rather than lose the federal portion of that, retain the federal portion of that to invest in improving your system. So yes, it's true that Florida was at a relatively high point. It's an arguable, how that worked out. It was, turned out to be a terrific deal for Florida. But I think regardless of where you are, the question is, are there opportunities if you have more flexibility, since the federal funds can only be used for out-of-home care, are there ways you can improve your system, provide more stability in families, safely achieve reduction in out-of-home care, and if so, having the predictability, having the consistency, and having the flexibility are potential advantages regardless of where you hit on that cycle.
Yes, maybe the last question.
Okay, and actually, just a comment. First of all, I want to thank Voices for Georgia's Children, as well as all of our sponsors for doing this, and definitely thanking all of you for coming. Georgia is absolutely committed to improving the safety and well-being of children. And I tell you, I'm so honored that I think in this room there's at least 3 previous DFACS directors in this room. Will you all stand up? 2 of my former bosses, and and I'm so, because we need one for but yeah, so I think that's the commitment that, they will not go away. They're going to keep coming. So, but again, and also I want to point out my staff. We have many state and regional directors from across the state, if you will stand. And I think too, I was so encouraged as I listened to you all, and I know for certain that Georgia's child welfare community, both public and private, we have a wonderful private partnership. I submitted our private providers here, and I will say that I'm certain that we do know where we need to go, right? And as I listen to you all, Georgia is definitely on the right track. Because as you all talked about, for instance, the centralized intake system and the uniformity, we're certainly, in that direction. We've already gone to almost half of our state. Another thing that you all talked about was the data piece, which is something that Casey, and particularly Dr. Waller, can tell you, is something that we've led the nation in terms of doing data, and we're doing a lot more of it. At this time, we're doing a predictive analytics. We are partnering with a statistician who's really doing some great work around that so that we can improve not only our training, but as well as our electronic case management system to be more intelligent in assisting us in identifying those patterns. We have a great public-private partnership now with the Child Advocacy Centers, and I think she's gone already, but she was here, because we're going to be doing a retraining of our staff, actually a new training in terms of interviewing children that we're starting, and we're also working with Georgia Public Safety in the adult realm. We have, you talked about the quality assurance piece, which is so important, and and that's something that we've been doing a lot of, and based on what we've heard from our federal folks, that Georgia has one of the most expansive quality assurance systems. We got in on the front end with CQI, Continuous Quality Improvement. A couple of years ago, we created a unit for that. But so as I listened to you and I thought, oh, these ideas are really great. And what I think my staff will probably looking at, and some of our private partners, is that, wow, Georgia is already doing quite a few of those things. So I really appreciate you all coming down and providing us with that. And thanks, Dr. Waller, because I think as we all walk out, we will say that we definitely know what the outcomes are and where we're headed to. And we're partnering together to get there. So thank you all so much.
Thank you very much, Dr. Hill, for those comments and particularly for your leadership. Just before we go, a couple of things. Lynn Bragg is the Casey consultant to Georgia and has taken all this in and wants to make just a couple of closing comments as well. And then I have just a couple of process things when she's done.
Thank you. I just wanted to respond to what Sharon had to say. And Sharon, I really appreciate you highlighting already some of the best practices and strategies that are already here in the state of Georgia. And when we talked about those infrastructure elements, a lot of those infrastructure elements are already in place. And so the question to slow everybody down with is, let's look at what we have and what we can continue to build on. Earlier I was with Sharon and her executive team and the regional directors, and one of the regional directors talked about voice, not being able to find her voice. And it's interesting, but as we've been hearing about this discussion externally, I've had so many off-the-record conversations with people about their opinions about the proposals that are on the table. So folks have talked about a horse already being out of the barn, or how do we have these conversations? You can convene people. And I've also noticed that there is one big voice that I have heard in this discussion. So my question is, I've been having all these other conversations with people who are actually talking about supporting each other, is where is that other voice? And so the thing is that there have been all these conversations, and it's been one particular group or this particular group, and it's about being able to bring all of the players together, not just the providers, or not, one particular entity driving this conversation. So that I would really encourage you all to bring everybody, the judges that aren't here at the table, the youth that aren't here at the table, the legislators, together in one room, and not all these conversations that I've been having with this person, and this entity. But the most important thing, it doesn't matter if you convene people, if you're not willing to have a candid and open conversation. It doesn't matter if you bring people are going to play nice. And you know, a lot of reform is driven by a lot of politics, and that I understand. So sometimes it puts you in a place where you may not be able to feel like you can say what you want to say, but see, if we don't have a voice, then our kids don't have a voice. And so I would encourage you, convene, have these community conversations, but have the courage to have those hard conversations. Your leaders sitting in here, and for DFACs, for various folks sitting in this, there's going to be some real impact if some of these proposals move forward. Educate yourself on what that means. Find out what the outcomes are. Understand what this means for you and your systems and how this plays a part, because I trust that if you do, you may be able to find that voice that you're looking for. So thank you very much.
Pat, is that your next forum?
Our next forum.
What you talked about?
We definitely, not only voices, but the other advocacy organizations we've been talking to, and we can open up those conversations to a broader group as well. But we do see that as our role, and I think we also see it as our role to do it in conjunction with the rest of the advocacy community. Timing is of the essence, as we all know. In fact, at 2 o'clock, there is a hearing, a committee hearing that will include this bill. And so I don't know what room that's in, but people might want to.
It's a subcommittee hearing. It's 4:50 at Capitol.
Okay. And so somebody's pointing, and I don't know what
She had a question that you want to put back in. She has a question.
Okay. I'm getting one signal and another. So do I have a question or don't I?
Yeah, I have a question.
Quickly.
I was a former foster youth, and so my question for the panel was, how do you have authentic collaboration? Because one of my concerns in seeing some of the news reports and even some how this bill came out, a lot of times I feel like a lot of people were saying all the right stuff, or talking about this, but as someone who is a foster, as seeing foster parents are often left off at the table, as youth, I feel like a lot of times we're left off at the table. How do we as people who are not affiliated with any particular organization or work, or like when we talk about taxpayer-based practices, how do we make sure that our communities are having real, authentic collaboration amongst, in a very political situation? That we make sure people do not lose the fact that when we talk about what catalyzes a lot of privatization stuff, it has to do with kids are dying every day. And so that has to be, how do we move the discussion to make sure that regardless of what we think, regardless of what things we think will work, how do we make sure that we don't lose that in the midst of a very political issue like this?
Thank you very much. I'm so glad that whoever was sitting behind you waiting for attention. And I think all of us have got to not just look at organizations, but individuals, and how do we really engage advocates throughout the community, not only in the small conversations, but in those direct phone calls and emails to the people that represent us. If you don't have access to that kind of contact information, please sign up with Voices, because we regularly report on this stuff. We give you the 2-minute ask that our advocacy director back there, Polly, puts together, not only with the why and the what, but here's the list, click on it, with the phone number and the email. And so I very much appreciate your stepping forward, and we do commit to helping to make sure that all these voices are heard. But again, time is of the essence, and so as you have networks of consumers or board members or funders or clients, members, it's really incumbent upon all of us to expand expand our access to them in order to bring them to the table. And so please help us expand this advocacy issue, help us expand the voices. We will do the smaller convening. We'll find a way to work with others to make sure that happens. And I think, we really have to, what I think Lynn was trying to say in part was, we can't go into this with a chip on our shoulders. This is about putting the kids in our vision and driving our behavior, our words, and our commitment with children and families in our vision. And I think if we do that, we will not be part of making it a we-they game or a powerful versus non-powerful game. We will make it a real commitment to helping to improve the outcomes and the safety and the thriving of all our children and families. So thank you very much for being here. We'll see you the next time.